we can start with maybe Brooke, if you would want to start us out in the conversation.
Happy to. I think Greg and I are going to tag team it a little bit,
Okay.
but talk through some of the cannabis and effects on the body, as well as some common concerns regarding cannabis.
Great.
So this is a very good resource in terms of continued up-to-date access for state-by-state information based on where you're practicing or where your patients are. It's the National Consortium of State Legislatures, and you can see there's certainly a patchwork of what type of access or program people have across this country. So sort of use and guidance and cannabis, even form factors or products that are available is quite different, which I think is an important thing as a baseline to note, because it both helps people explore this for symptom management as a cancer patient and deters or impairs safe access, because you can see the people living in the red, pinkish, salmony color and white states are ones that have no access to kind of broad spectrum cannabis products. So what people are getting is very highly unregulated products. We can talk a little bit more about this, but this is kind of the up-to-date world we live in. So just a little bit of kind of the nomenclature around cannabis and understanding what we're talking about here, because when a piece of some federal legislation called the Farm Bill passed back in 2018, it effectively separated the way the federal government looks at marijuana versus hemp. And basically all of that falls under the bucket of cannabis, which is the sort of genus and species name of a plant. But marijuana, US sort of federal law defines it by the amount of Delta 9 THC in it. And so that's the cannabinoid that kind of crosses the blood-brain barrier and results in people sort of feeling high. And that is what delineates whether people are talking about marijuana or hemp. Otherwise, it's basically the same. Obviously, it's the same plant, but you can extract things and get various combinations of those cannabinoids. CBD can be predominant in both, but what this means is that people are able to access a lot of these products that are hemp-based outside of state-regulated dispensaries, and the ones that are sort of classified as marijuana, they're getting inside state-regulated dispensaries. This is kind of why there is such interest in cannabis as a medical therapeutic, because we have something called our endocannabinoid system, which is a kind of very complicated system of receptors that sort of, as you can see, span the central nervous system as well as your periphery. And our body makes things that look kind of chemically exactly the same as some of the what we call phytocannabinoids, meaning the parts of the cannabis plant that are in the plants. So we produce substances that mirror that and have a beneficial or sort of impactful relationship with our body in all kinds of different things. So the way we perceive pain, the way we sense anxiety, the way we perceive and what our body does when it feels nauseous, also the way that we handle inflammation. So there's a lot of components to the endocannabinoid system that certainly overlap with a lot of the side effects of cancer treatment as well as cancer itself. So let's talk a little bit about some of the concerns. Greg, I'm going to toss this over to you to talk through, and certainly if there's anything that would be helpful, I'm happy to chime in. But
sure, happy to. And hi, everybody. Thank you so much for having us today. So cannabis still remains federally illegal. It's really a state-by-state hodgepodge of different programs and policies and conditions that are approved for certification. It really some of which is a little bit evidence-based, much of which is based on the preference of a legislature in whatever state that it is. Cannabis is in the process of being rescheduled from a Schedule 1 drug to a Schedule 3 drug. That the comment period on that has finished, and an administrative law judge will be kind of hearing final arguments in the beginning of December, I believe. And that will be meaningful for research and for some criminal justice reform and some other things in terms of what it will mean for kind of folks out there in the community. Probably not a whole lot. It will also mean something for the business, the cannabis business side. Can you get in trouble legally? It really depends where you are in our country. We have not had any issues with this. Most states that have cannabis programs are, many have decriminalized it or turned it into a much lesser offense. Our patients who've been certified to travel domestically with it on planes and bring their card with them, we've probably certified about 5,000 patients to date, and we have not heard any issues. There are obviously some employers, federal government does not allow this, public transit authorities, airlines, obvious things. And you can find where Dr. Worster had pointed in the state legislators' website and many places kind of what the regulations are specific to your own particular state. Let's go ahead. Most of the research that we have done kind of in our country and other countries, with some exceptions, is observational. It's based on focus groups and surveys and just kind of better understanding kind of how people, when people, why people use it, effects that it has. Kind of gold standard randomized controlled trials we are very, very hard to conduct in our country because of cannabis's Schedule 1 status. So you have to get a Schedule 1 permit from the FDA and DEA, sorry, excuse me, I get the A's all mixed up there. And jump through all kinds of hoops, and then you need to get cannabis from a federal supplier, of which there are a few now. Those products don't really mirror at all what we are finding in dispensaries, either adult use or medical dispensaries. So it's not really translatable. There are countries, Australia, Israel, Uruguay, others who have done kind of more rigorous research. And a lot of what we understand to date is from those countries that have kind of different legislation, different policies on cannabis research. Okay. And lots of questions that folks have. And we have, Dr. Worster and I, since 2017, when Pennsylvania's program came around, we decided we wanted to get out in front of this and not create another kind of healthcare disparity and provide education and access for our patients in the state of Pennsylvania and New Jersey to kind of some extent as well. And answer these questions to the ability that we could, where we had guidance. And obviously, folks know that people living with cancer are kind of more complex. They're on more medications. They have, all kinds of other challenges. So we spend a lot of time answering questions and helping people kind of get certified and access either cannabis in a dispensary or find reputable products that they were able to buy kind of online or from a store.
And I think those questions are all the questions that we hear all the time, and there's not a simple binary answer to it, right? It's not like the answer to will it impact my mental health is a yes to everyone or a no to everyone. And so some sort of personalized guidance is really what's helpful to that individual and is quite hard to come by often. Just not that clinicians don't want to, it's just that none of us were trained, and as we're sort of, it's like we're all growing up together in some ways, right? This is available out there, and so patients are using it, and caregivers are interested in obtaining it, and the medical profession is saying, we need to sort of study this and learn. And so it's kind of like we're all on this parallel path trying to do it together.
Do you want me to keep going?
Yeah, go ahead, please.
Right. So as I mentioned earlier, there is an effort underhand to reschedule cannabis to Schedule 3, which is like some common drugs like Tylenol and codeine and anabolic steroids, things like that, which is really huge. I mean, a Schedule 1 drug, which most of you probably know, is a drug for which there's been no determined medical use, like heroin and hallucinogen LSD and other things like that. This will and should open up and make research much easier. We don't know all the mechanisms for that yet. The NIH has been funding cannabis-based research, mainly kind of survey-based, but this should open up additional streams of kind of taking a closer look and doing, well-designed interventional trials. And it hopefully will make it more accessible and affordable. We don't know really what that will look like yet. But right now, with a state-by-state hodgepodge of systems, everything that is sold in a state must be produced in that state. So you can imagine like the tremendous inefficiencies, higher cost, all of that. So if you want to sell a product in California and that same product in Pennsylvania and Massachusetts and Florida, you need to build production facilities, growing production facilities in those four places. And so, we imagine that will have some downward pressure on price. And plus, businesses right now who are in this area are taxed like they are federally legal. So they pay tax on all of their revenue from $1. So writing off business expenses and other things that all other businesses, legitimate businesses, can do, they can't. So there's reason to be for some optimism for both the people on the business side and the consuming side in terms of price pressures. But by the way, both candidates are supportive of this. So while the outcome of the election should not influence the progression of this necessarily, it'll influence a lot of other things, but not this. And so when we look at kind of the available research, there are some very interesting emerging things. And this is kind of what we've kind of read and seen and seen studied, but we've also kind of in speaking with a number of patients that we have, this is kind of borne out clinically as well, which is interesting. So certainly cancer pain, we have seen patients benefit, and there's research suggesting that supporting cannabis for cancer pain, both kind of visceral and neuropathic, migraines as well. Certainly chemotherapy-induced nausea is a bit of a home run with this. That kind of, we've known this for lots and lots and lots of years. Very helpful. Recent, very interesting randomized controlled trial out of Australia, kind of a well-done study. We had 3 arms of patients getting chemotherapy and adjuvant antiemetics, and added different cannabis formulations to a couple of those and standard of care to another. And there was a kind of a very significant effect for those in the cannabis arms, but worth looking up. I think it was in JCO. Appetite stimulation, just kind of making people hungry. One of the biggest things that we hear in our clinic is, I don't have any taste for food. I've lost weight. I'm just not enjoying eating. Anxiety and sleep, other things that patients are looking for as well, and for which there is some interesting evidence, more favoring with anxiety and sleep CBD than THC, but jury's still out. We still need more research on that.
So it also matters how people are using cannabis or ingesting it and what the composition of it is. So I say this strongly with my doctor hat on. I tell patients all the time, lighting anything on fire and inhaling it into your lungs is not advisable. There's, it's not directly linked to cancer like nicotine is, but there are concerns both from kind of cardiac and pulmonary issues that make me want to steer people away from smoking. And part of the problem, or inhaling, so vaping, part of the problem in kind of a mismatch of what's available versus what you should use is that a lot of dispensaries are geared towards kind of recreational users, and so have a lot of stuff that you smoke. So kind of guiding people towards what and how to use things that are not smokable is important. The other thing is Interestingly, CBD, which has some concerns about taking higher doses of it and its impact on your immune system if you're getting immunotherapy, it also has great anti-inflammatory properties that helps from kind of a vascular protection perspective. So, I think it's figuring out how to thread the needle there. As a lot of the products on the marketplace get increasingly potent, and by potency, we're specifically talking about that Delta 9 THC, we are seeing an increased risk of kind of manic or psychotic episodes as people are using high potency products, cannabis hyperemesis syndrome, which is a kind of, opposite effect when we talk about kind of cannabis being anti-nausea, it as in a small amount of people, but it really is a dangerous thing where it promotes nausea and vomiting, and people think I should use cannabis more to treat this, and then it becomes this sort of really bad cyclical thing. And then as especially kind of vulnerable populations like teenage or young adults are using very high potency cannabis, we have seen an increase in what is called cannabis use disorder, which is similar to any kind of mind-altering substance where people use it in spite of negative consequences. And so, being aware and recognizing that this is a possibility and helping guide people or put guardrails around where it can get higher risk is important. The other thing that we see all the time that is a consequence of kind of our state patchwork and some of the federal regulations is that there's a whole lot of variability in what people get, not just in what is legal, but what you can buy on the internet or in unregulated sources that is quasi-legal and has no regulations surrounding what's in it. So things like pesticides and other organophosphates that are dangerous to your health, as well as just vast misrepresentation of what is on the labels, right? So there's been some studies that looked at what people are getting from those quote unquote smoke shops, and the accuracy in labeling just isn't there. We see people get anywhere from like 600 to 600% of what is said to be in the product actually in the product. So kind of a lot of that buyer beware when people are getting products without any kind of guidance or regulations around them. And yet most cancer patients access this without any clinical guidance. And there's a lot of reasons that are sort of multifactorial and complicated about this. Some of it is solely on the shoulders of the medical profession not having a good answer or feeling comfortable talking about it, so just not talking about it. Some of it has to do with sort of the longstanding kind of regulatory issues and concerns, real concerns of getting in trouble, right, or getting arrested or policing around this. So it has kind of created this closeted space where people basically kind of access this in a way of not getting good guidance. And this is data from a study that we had that was funded from the NCI that we sort of found that less than 10% of people get guidance from a medical professional about their use. And these are cancer patients or patients in survivorship or any sort of path, stage along that path. But very, very few of them are getting medical guidance from medical professionals. Here's the fun part.
Yeah, I was going to say the same thing.
Oh, yeah. Good afternoon, everyone. Great job, Brooke and Greg, and it's good to see you, Christina. Yeah, so my name's Ethan Zohn, and I am an ambassador and advisor for EO as well as for CancerBuddy. But I guess I'm best known for being the cancer survivor who won the reality TV show Survivor. And I'm just happy it wasn't on that show, The Walking Dead. So I'm happy about that. But, so I just love to share a little bit more about my story and my journey with cannabis and cancer. So, in 2009, I was
like you go to lunch or something, or get another patient.
Other voices.
Yeah.
I'm also a ventriloquist, so that's pretty cool. But yeah, so in 2009, on top of the world, 35 years old, training for the New York City Marathon, and I had some really itchy skin. And I tried every pill, cream, lotion known to man. And after about 4 months of wondering what was going on inside my body, I was diagnosed with a rare form of blood cancer called CD20 positive Hodgkin's lymphoma. I went through multiple rounds of chemotherapy, 22 blasts of radiation, and 2 stem cell transplants, one an autologous and then one an allogeneic one using my brother Lee as the donor. And I'm happy to say I've been in remission for 11 years. However, going through cancer at the time in 2009, 2013, it was obviously, as you can imagine, an incredibly challenging time in my life. And the doctors kind of, as you know, prescribed me a whole buffet of synthetic medicine just to try to make me feel better and kind of help with the side effects of cancer treatments. And I wrote all of them down, and I'm sure you're very familiar with these, but it always just shocks me of how much I was putting in my body every single day. And I was on Percocet for pain, Zofran for nausea, Xanax for anxiety, Ambien for sleep, Lexapro for mood, Ativan again for, I guess, nausea and relaxation, Adderall for energy. And then I was like trying to eat as much as possible, and Ensure and full fat milkshakes, just to kind of make myself feel better. However, it wasn't really working. So I was just interested in learning for alternative ways to kind of mitigate the side effects of cancer treatment. And I had heard about medical cannabis. Obviously, I went to college and never touched the stuff because I was a soccer player. I was an athlete. I wanted to play professional soccer, so wasn't part of my daily life over there. I did try it once, second semester of my senior year. Don't tell my mom. I just wanted to do something crazy before I graduated. But so here we are, 2009. I really wanted to try something different. However, when I went to my oncologist and nurse practitioner and palliative care and integrative oncologist, not one person at my cancer center could educate me on how to use medical cannabis while having cancer. And in addition to that, it was really difficult for me to find trusted, reliable sources of cannabis. So imagine me, bald with chemo, mask, gloves. I'm hitting the streets of New York City talking to a drug dealer. And this is a guy that was selling cocaine and ecstasy and opioids and medical cannabis. And so to do an illegal activity on something already as stressful and horrible as cancer was not a great experience. And once again, when I asked my doctors, like, what should I do? They said, just don't smoke it. That's the only advice they gave to me. And so I went on a journey to just try to figure out how I could use this stuff to make myself feel better. Talked to a lot of friends, researched it, what was considered online back in the day. And I finally found a woman in Boston. Her name was Janabis Cannabis. And she was a nurse, and I had a 60-minute telephone call with her. And it was a game changer for me. She told me, the differences between CBD and THC, sativa, indica, dosage, how to cook it, like when would be an optimal time to use it when kind of going in for certain treatments. So she really gave me like a holistic approach to how to use cannabis while going through cancer. And that was incredibly helpful for me at that time. But, it was still a pretty scary situation. And to be able to walk into a dispensary and see the host of different products on the shelves there and try to visit with a bud tender wasn't a good experience as well, easy. Like the normal path, as we may know, is you see a medical cannabis doctor, they give you your card, and then you never really see them again. So there's no ongoing relationship with a doctor here. And then they send you to a dispensary, which isn't a hospital, to talk to a bud tender that's not a doctor. And they're telling a guy like me who's got cancer what I should be using, how I should be using it, and when. Meanwhile, they're not taking into consideration just how I live my life, all the medicine I'm currently on, the exact disease that I'm having, cross indication. So once again, that experience alone was very difficult for me to navigate, as a young adult. And I guess the big difference for me when I finally figured out a good routine is like with these synthetic pills, I was always like chasing a feeling. Okay, I was in pain, so I take a Percocet and wait for that to kick in. And then I had a time it when it wore off, and if I had to drive to go do some errands or go to work that day, or when do I have to, play sports, or when do I want to sleep, and when do I want to have energy? So like I was always just like my whole day was so unbalanced. It was like highs and lows, chasing a feeling, popping a pill, and it wasn't a situation. As we all know, cancer is a very uncontrollable feeling. And when a doctor tells you to do something, you'll die, you pretty much do it. So there's no balance there for me. And so when I started using medical cannabis during treatment, it actually just balanced me out. It was a more predictable situation because I knew exactly how I would feel, when I would feel it, and I could plan my days, and my days were more balanced that way. And that's a huge deal for a cancer patient to gain control back over the body or their mind and the spirit. And post cancer, I was plagued with extreme anxiety, fear of relapse, invisible scars that need healing, as you can imagine, any young adult cancer survivor will face. And so the post cancer use of CBD and cannabis for me was even more impactful than during treatment because I was, I couldn't even really leave the house. I was so like stressed out and had anxiety. So I really dug into the CBD. And so I use CBD every day now, like a multivitamin. Sometimes if I'm having a particular difficult day or I'm going in for scans or whatever, I might change that and do more of like a 1-to-1 ratio between CBD and THC, just something a little bit stronger. And that's kind of a little bit where we are today. And I just really think it's the duty of the industry and the healthcare professionals and the healthcare providers to be able to have a solution for when their patients want to use cannabis. And just from my experience and talking to a lot of friends and through some of the research that Brooke and Greg are doing, that's not happening right now. I think 40% of cancer patients use cannabis. 70% of oncologists don't feel comfortable even having a conversation with their patients and do not know how to advise or recommend products for them. That's insane to me. Like you would never walk into a doctor's office and get a prescription for Percocet or Tylenol with codeine without any medical oversight. It just doesn't happen. Yet that's exactly what's happening in the cannabis industry right now for people who are really struggling with disease. And I was one of those guys. Like I'm a daily user. My monthly bill is fairly high when using medical cannabis, and so these are the people that actually need the guidance. And to leave it to a cancer patient to figure it on their own is just the system's a little bit broken. So that's why I'm so excited to partner with EO Plug, because that's exactly what they do. Personalized, physician-guided medical cannabis care plans for cancer patients, survivors, caregivers, seniors. That's what we do. They do it incredibly well. And Brooke and Greg are the ones overseeing the whole thing. And in addition to that, we even have products. We have products that we are specifically designed and developed for cancer patients, which is different than everything else that's out there. We really take into consider the whole person and some of the issues that we face throughout the cancer experience, the cancer journey.
Does EO, Ethan, this is actually, I didn't even introduce myself, but I'm Christina Merrill for those who don't know me. And I am the founder of the Bone Marrow and Cancer Foundation and CancerBuddy. So just a little intro. But Ethan, in terms of patients, and to Brooke and to Greg, how do you get this information into their hands without having to depend on the oncologists and the doctors or nurses to share your information? Because I find that is even the hardest part of even sharing our CancerBuddy app or any of our programs that are so incredibly important to support patient care, but it's very hard to get it out there.
Yes, I'll let Greg answer that.
Yeah, that's really an outstanding question. And certainly, oncologists and oncology care professionals have a big job on their hands, and kind of adding additional kind of responsibilities and resources is always a challenge. And so we have been speaking with a lot of different cancer organizations and cancer hospitals and cancer practices, with American Cancer Society and other kind of cancer support community, other kind of big organizations with a more national scope, and trying to get this directly to patients. In our own clinic, it's part of our supportive oncology practice. This is just the default. When we talk with a patient about cannabis, we hand them information and we say, this is kind of this is what we endorse. This is kind of the best way to do it. And I'll talk a little bit more about this. There is a lot of utility to kind of having people go through this profiling and being able to provide us with kind of real feedback that helps kind of us develop a model by which we can kind of more confidently make recommendations as we allow kind of clinical research to catch up.
Because I know it's difficult for hospitals to back, other organizations or companies with products because they don't want to be responsible because of the whole legality of it all. So that I just find super challenging, besides putting your information on sides of buses and, standing outside of cancer centers.
Yeah, it's a good point. So this EO Care is a separate entity, and so it is, as I'm a social worker. So as a social worker, we are always referring our patients and their caregivers to outside entities to provide a service or a whatever it is, and this is that. So it really doesn't come up against. It doesn't necessarily need to be an endorsement by a hospital per se. It's a resource.
Yeah.
And that's kind of how it has been treated. No, you're right. They don't want to. I mean, Dr. Worster has a very large research program here, and has spent hours and hours and days educating IRBs and our legal department and stuff like that for the purpose of, kind of really wanting to research and to provide better patient care. But that's not necessary.
Yeah.
This is just as a social worker, it's like another resource, another kind of value add that we can give to our patients.
And Greg might get into it, but I mentioned the products that isn't necessarily our core competency. We provide care plans for cancer patients that want to use medical cannabis, and we even offer the opportunity to pick products for you at a local dispensary that's closest to you or that's easiest for you to get to. You can pick them up there, or we can get them delivered to your door. Like, our technology can scrub the menus of these dispensaries, find the products that are best for you, pick them out for you, you go pick them up, or you have the option to use products that EO has developed as well.
And you speak a little bit about pesticides and patients that get certain, side effects, being psychotic, or if they use something that's too strong or something like that. I mean, how do you go into a dispensary that's maybe close to that patient's home and try to make sure that cannabis that they're picking up is without different, with pesticides and all that?
So
I mean,
at dispensaries, regulated state dispensaries have to have quality products. They have to have external testing, and it's on the labeling, and what's there is accurate. So it's less the additives in that space and more the potency that people need some guidance on. The contaminants and additives are really from all of the unregulated, like smoke shops and internet spaces and all the other ways that people can get their hands on them.
Okay. And do you find that patients I know that there's a new issue out there that I've heard about, that that some patients get, kind of a stomach issue, that they get sick and it's a cannabis related issue.
That's the cannabis hyperemesis syndrome, that people that are using cannabis very frequently and kind of high potency cannabis tend to struggle with really significant nausea and vomiting. And if you're ever seeing that or hearing about that, really the only treatment for that is that person has to stop using cannabis. Mm-hmm. Right? Like it's just like having an allergy to another drug or something like that, right? It is just not compatible with your system.
And typically, I think, Brooke and Greg can answer this, but typically with cancer patients, they're not looking at these high doses of THC. We start everyone obviously low and slow is the rule, but 2.5 milligram doses. If they need a little bit more, maybe up to 5. We're not talking, some of these products that these dispensaries sell these days in the recreational space, which kind of overlaps a little bit with the medical space, but you're talking like super high THC content that wouldn't necessarily be beneficial to a cancer patient. And that's kind of the service that Brooke and Greg provide and what EO provides is we help you figure that out. So you don't have to do it on your own. You don't have to worry about overdosing or taking too much or psychoactive things that make you feel uncomfortable. That's exactly why we're here.
That's great.
Other questions?
I guess some of the other things is Ethan, you spoke a little bit about the CBD versus THC, and can you talk a little bit about that? Just, the CBD, because that's obviously legal at a lot of different places. You can get that.
Yes, I mean, anecdotally, and Brooke can tell you the medical side of it, but I've found that, the best products for me personally are the ones that combine both CBD and THC. And these are just two little cannabinoids within the plant. There are hundreds. Not all of them are discovered. There are some other cannabinoids that are very beneficial to your health. They aren't psychoactive. They don't get you high. And so that's what we're playing with, all these different cannabinoids within the plant to help provide the best product for you. But when the cannabinoids are working together in harmony, it's called the entourage effect. So that's why, that's how the plant lives in nature. It's nature is the world's pharmacy. So some of these products is using both CBD and THC. For me, the CBD kind of counteracts the paranoia and total psychoactive part of the THC and kind of levels me out a little bit. But I'm sure Brooke has a more medical answer to this question.
I mean, I think you hit it in general terms. It's a little bit like finding the right antidepressant for someone or the right, blood pressure medicine in some ways, right? We each kind of genetically are made up a little bit different and so respond differently to different compositions of the plant. And so it's not like one hard and fast, but typically, what Ethan said is accurate.
So the CBD will not get, if a patient is worried about getting high and they just don't want to have that feeling, and they
Correct.
just want to have something that will help them with anxiety or stress and just get them a little bit calmer, that would be a good.
CBD for sure is the substance that does not cause that high. So yes, that is a very standard, fair thing to say.
Let me.
But in addition to, oh yeah,
No, go ahead, Ethan. I just to contextualize all of this in terms of what EO actually kind of concretely looks like. Let me go through a couple slides and then we'll just move on to more Q&A, because I think that this is kind of material for that. And so EO essentially, you walk into a doctor's office, you get a prescription for something, you go to a pharmacy, you fill it, that prescription lives in the electronic health record of wherever your doctor is. There is some record that it was filled. There are directions on it on how to take it. Cannabis is nothing like that. I'm sure many of you are aware of that. And so EO is an attempt to provide some education and structure and some order around this. And it is a platform on which you can profile, that does not takes a few minutes, and where you're saying kind of the symptoms you're looking to get treated and the medications you're on, the disease for which you are being treated, the modalities of that treatment, whether you are wanting to have THC as part of that regimen, and a variety of other questions. And that all kind of comes together and a care plan gets generated, which looks very much like a prescription. It's a schedule that says, here are the recommended products at this, and this point in time. Here are what are called ad hoc or PRN products if you feel like you need a little bit more or not getting great relief. And then at intervals, it is requesting some feedback, which are being collected via promise measures in terms of how you're doing with regards to symptoms. Also looking at activities that you are kind of enjoy doing and your ability to do those and tracking that over time as well. So it has a kind of very interesting, and this data that gets collected goes into the formula, into the algorithm that kind of creates these care plans, which are all reviewed by clinicians. One of the interesting things that Dr. Worster and I have found in our clinic is we thought that this would be, much more appealing to newer cannabis users, and it certainly is. That group is always in need of guidance and kind of welcoming of that. But we've noticed an equal amount of experienced medical cannabis users that are interested in it as well, because they've kind of gone it on their own. And so it's good for them too. And they kind of stick on it because it's like providing some structure and some process that they've been doing that's often trial and error and very highly expensive and back and forth to a dispensary. And for those who do not want THC, who just don't want to feel high, it kind of can make completely CBD based plans, which is which we hear a fair amount of as well. Even though, as Ethan says, this is all kind of very low and slow. There is an opportunity when somebody wants to look to manage symptoms that you do not want to kind of blast them away with a tremendous amount of THC and have a negative, frightening experience. And so kind of very sensitive to that. On the EO page, there are also a variety of different educational resources of patient stories, all kind of academically curated, not the patient stories, but the education and research materials. And there is a kind of an LLM, an AI-driven search engine that can kind of have a conversation with you about your questions about cannabis. And that it's trained on evidence-based sources. So it doesn't just kind of go out into the web and come back with whatever somebody's put on Reddit or whatever other site they're looking at, which has been really fascinating. We have a kind of a helpline as well, staffed by folks who are kind of well-versed in this space, many of whom have medical backgrounds, and can kind of provide the kind of basic educational stuff, answer questions. All people have very little knowledge of this, so the questions are often kind of really, really simple, but really important. And so kind of feeling that it's very important to kind of provide support necessary for people who do want to add this as part of their symptom management regimen. And so this is kind of what it looks like. And this is how you do it. You can take a picture of this QR code. You can click the link. We'll share these slides, of course, with you. And can use the CancerBuddy app as well. All right, I'm going to stop talking now.
And just to kind of expand on that, so we have a CancerBuddy, on our CancerBuddy app, we have a cannabis group that EO Care runs. And so you can go into that group. You can download our app on iOS or Android, and you can go into that group and ask questions and receive information and just have, share it with your patients and their caregivers and survivors so that they can go to a group and have support there as well.
One thing I just like to add is that I think the general perception of cannabis is you got to smoke it. And I know Greg mentioned like EO doesn't provide any smokables, or doesn't necessarily provide any smokables, but there are so many different modalities. There are capsules, there are like gummy edibles, food products, there's inhaler, like a asthma inhaler, there's tinctures that go under your tongue, there's patches, there's like balms that go on your hand, topicals. So when people are like, oh my God, like, hey, I don't want to smoke. Well, that's okay, because there are so many different ways to get cannabis into your system. And this is just the early days of cannabis. We're in the first pitch of the first inning of a 9-inning game. And, with this new reclassification coming up, research is going to be expanded, and a lot of different technology and modalities and consumption methods are going to be coming out in the future. And then, that's our job as EO to figure out which way is the best for you to use with your particular situation.
Well, I think this is great information, because I know that patients are either shy or not comfortable asking their healthcare provider or doctors about using cannabis to help with their symptoms.
Sure.
And so it's really important for just patients to kind of be able to have a place to go to really get educated and get support.
Yeah.
So,
I mean, there's still so much stigma around cannabis and medical cannabis. Like, it's the gateway drug, it's bad, you're going to die, don't do it. And especially we work with a lot of seniors, seniors plus cancer, it happens, it's happening a lot. And that demographic is, I would say, more fearful of trying cannabis, just based on what they grew up in, the stigma around it and all the negative messaging around medical cannabis. So so it's kind of it's good to be doing what we're doing and giving webinars and giving speeches, and everyone here on this call, now you are a little bit more educated and you have the ability to kind of share your own story with cannabis. And if anyone comes to you and asks for help, now you have a place to refer them to.
And I think there's a question here. Let me see what this question is. Oh yeah, we have recorded it. And oh,
I
here,
see the
plans to expanding this to adolescent, young adult population.
That's a great question. And I think that is a population that needs a lot of guidance, in more ways than one, probably, but specifically keeping it to cannabis, because those risks of use in a developing brain are real. I think absolutely the young adult and adolescent cancer patient population is a population that we would like to, really expand to in some way to kind of take care of. I think it takes a lot more open dialogue, and often, depending on the age, we're talking about with now a parent or another caregiver, and the clinician. So yes, I think that's a really important population to tackle. I think we need to get some better research around kind of who can benefit and when, to feel like it's a responsible discussion. That being said, we're not shying away from having the discussion with a young adult patient and their caregiver or parent or someone that is struggling with cancer treatment symptoms, to say to them that this is an option, and depending on where you live and how you can get it, and then that kind of stuff. Because what we don't want is for anyone to feel like they can't have an open conversation about it, right? Removing the stigma is one of the biggest things, and especially in that population. So, happy to have those conversations with that population too.
Okay, let's.
Yeah, I mean,
I was going to just say there's 3 of us here who are in peds and adolescent young adult oncology. And our patients come to us with edibles. I mean, they come that using them, and I don't know where they're getting them. I don't know how they're not being managed. They're not necessarily even telling, their care providers of what they're doing. I just ask, and then they say, oh yeah, and they're coming onto federal property. So, which is not always the easiest thing to do anyway. So this is wonderful. This really is. And it just being able for them to be able to have a place where they can be able to get information based on living with cancer, and to be able to, be able to talk about what's safe and what's not. I mean, some of the conditions, we know that cannabis could be much more difficult for our patients with medullary thyroid carcinoma. They have a lot more GI issues. They just need really good guidance, and the research is just not there. So thank you for this, and thank you for what you're doing, and from 3 of us here. And
we have a great AYA group on our app. There's about 550 adolescent and young adults in that group on CancerBuddy. And so I would suggest for you to share that information, and then they can go into also the cannabis group on the app as well, and join that, and be able to freely ask questions.
thanks.
and Brooke, I don't know if you have an answer to this, but I think and I could just be making this up. Do young adult cancer survivors have a higher instance of becoming dependent on drug, like any form of drugs or alcohol, than the average population?
That's a really good question. Any form of drug. Now, I don't know across the board any form of drug. I do know that because the exposure to opioids is higher in this population than a general youth population, the risk for that is there. I'm not sure how much kind of longitudinal, well done data yet there is to look at the long-term impact and if it diverges from a general population, but you certainly have a higher risk starting point.
I mean,
And in cannabis, it's not. Like when
Right, that's
we
my
have
point.
huge PEDS databases and other things, there isn't a higher risk for long-term use than the general population, for sure.
Yeah, that was kind of the point. I mean, personally, from my friends, I know a lot of my friends at the time when we came out of cancer, there was a lot of stuff going on with, you know, alcohol and drugs and
Mhm.
just using what they had prescribed to us, but kind of using them a little bit more frequently. And I just know cannabis could be a solution to not have that risk, or to lower the dosages or get off some other synthetics completely by replacing that with a cannabis regimen.
Well, I think that in general, mental health and cancer is such an area of concern and for patients, and especially for young adults, and because they don't know how to manage it emotionally. And I think that then they start to use different substances just to kind of mask their pain of what they're going through and feeling so isolated, especially, kids that are taken out of high school because of their cancer diagnosis, or they can't go on with their life with college. It's just a really hard age for them to deal with. So, but no, this is great information, and I just hope that it can get out to hospitals. It's too bad that in the, previous years, probably in the early 2000s or late 90s, it was easy to kind of put your brochures in hospitals around the country and nobody would remove them. And it was really easy access. And these days, with so many legal and regulatory issues within hospitals, you can't leave brochures and educational information around hospitals. I'm sure that Brenda probably could speak to that as well. I don't know if you're able to do that at your center. So it's difficult.
We keep them in clinic with us, rather than in our, I mean, we do have some in our patient education area. We don't police that so much. But we bring them, it's like a clinical tool. We bring them when we're having a conversation about cannabis. It's just kind of automatic. And you can, there are a lot of, you can find this online fairly easily. There's a QR code on them, like whatever level of digital access, patients want. And if patients want help, they can call our phone number and they can have somebody walk through a sign up with them. Because one of the things that we've kind of certainly learned about is varying levels of digital literacy and access. So, there's a kind of a real desire to kind of create access and to understand the barriers and make it simpler. This has been an iterative process, and the platform has gotten simpler and simpler and simpler based on feedback. So it helps us, evolve the model.
It's great. Okay. Well, I guess we're coming to the end of our conversation, and this is recorded, and we'll send it to everybody that's on the call. And if you can reach out to our team at CancerBuddy or at EO, and we will, we're all in this together to help patients, find the support that they need in this area of cannabis care.
My email is also on one of those slides. Feel free, you can reach out individually to me, because I'm always thinking about, how to operationalize things like this. So we're not having brochures thrown away by any organization that is, legitimate and kind of adding a value to, our patients and their caregivers. So do feel free.
Great. Well, thank you, everyone. And
Thank you for having us.
doing this again, and we'll just keep the information, out there.
Right.
Thank you all so much.
Thank you.
Thank you
Thank
all.
you, Brooke and Ethan,
Bye.
everybody. Thank you. Bye.